Hi, my name is Dr. David Ricker. I'm a pediatric pulmonologist or respiratory specialist at Marybridge Children's Hospital and Health Center. This asthma educational video is brought to you by the Marybridge Respiratory Clinic. Aside from tooth decay, asthma is the most common chronic illness in childhood. When you have asthma, your airways are more irritable or twitchy. Your airways, your bronchial tubes, they can react to certain triggers, which cause the muscles surrounding the airways to constrict, the lining of the airways to swell up, and the airways to secrete extra mucus. This can cause coughing, wheezing, or trouble breathing, commonly called an asthma attack or asthma flare-up. There's two main things you can do about your asthma. One is figure out what the triggers are so that you can reduce or eliminate exposure to the triggers. And the other thing is medications. Asthma is not curable, but it is very treatable. Even some Olympic athletes have asthma, so it doesn't need to be a reason that you'd stop playing sports or miss school or feel left out of having fun with your friends.
Asthma triggers are different for different people. Common triggers include colds, weather changes, tobacco exposure, exercise, household chemicals, and allergens. Allergy testing is one way to figure out your asthma triggers, but it's also important to pay attention to situations that make your asthma worse. Try starting an asthma symptom diary and look for patterns. You can't eliminate exposure to all triggers, but take the time to minimize those that you do have control over. Keeping your home dusted and vacuumed, preferably with a HEPA filter, and washing your bedding weekly is a good start. Also try to control the humidity to prevent mold, limit the exposure to furry animals, and avoid strong fragrances, chemicals, and smoke, including cigarettes and campfires. Reducing routine exposure to household triggers may lessen the severity of asthma symptoms during pollen or cold season, and getting your annual flu shot helps too.
There are two types of asthma medications: asthma controller medications, which are meant to be used on a routine daily basis, and asthma rescue medications, which relieve asthma symptoms. An asthma controller medication might be delivered with an inhaler, a nebulizer, or in pill form. They reduce swelling and help to make the airway less reactive to triggers. Controller medications should be taken as prescribed even when you aren't experiencing symptoms. Asthma rescue medications are typically used during an asthma flare-up. Albuterol is a common one, which may go by Ventolin, Proventil, or ProAir. They act as bronchodilators, which means that they relax the muscles around the airway to improve breathing. Use it at the first sign of symptoms like a cough, feeling of tightness in the chest, or working harder to breathe. Your provider may recommend using your rescue inhaler 15 to 30 minutes before exercise. There are many different asthma medications, with new ones coming out all the time. Your doctor will carefully choose the right treatments to help manage your symptoms. Refer to your medication packaging for details on how to administer it correctly. There are three types of devices that deliver asthma medication: metered dose inhalers, dry powder inhalers, and nebulizers. Metered dose inhalers usually have three parts: an L-shaped plastic piece called an actuator, a metal canister which contains the medication, and a built-in dose counter to tell you how much is left. For best results, always add a spacer. This tube-shaped device increases the amount of medication that ends up in the lungs instead of settling inside the mouth and throat. To use a metered dose inhaler, prime the inhaler as directed if it's new or hasn't been used in a while. With the canister inside the actuator, shake it up and down for 5 seconds and then attach the spacer. Have older children sit up straight, take a deep breath, and exhale fully. Place the mouthpiece into the mouth on top of the tongue. Close the lips tightly to keep it in place and get a good seal. Press down firmly on the canister to release a puff of medication into the spacer. Then take a slow, deep breath and hold it as long as you can, up to 10 seconds. Repeat after 1 minute if directed. Children under 4 will usually need to use a spacer with a mask instead of a mouthpiece. In this case, hold the mask in place for 6 breaths after each puff while they empty the spacer. While using a spacer is always recommended with a metered dose inhaler, if you aren't using one, open your mouth wide with the chin up, hold the inhaler 2 to 3 finger widths away, breathe out gently and fully. Start inhaling as soon as you press down on the canister, taking a deep breath. Hold your breath as long as you can, up to 10 seconds. Dry powder inhalers do not create a liquid mist or puff and do not use a spacer. As you breathe in, the powder is pulled out of the device and inhaled into the lungs. Unlike other inhalers, you might not taste, smell, or feel the dry powder. Just prime as needed, open as directed, take a deep lung-filling breath of the medication, and hold for 10 seconds. Nebulizer treatments use an air compressor, tubing, plastic cup, and a mouthpiece or mask. It will plug into a power outlet or use a portable battery. Like a metered dose inhaler, the liquid medication comes out as a mist, but instead of creating puffs, the nebulizer releases the mist continuously as the patient slowly breathes it in. Continue the treatment until no more aerosol is produced, about 10 to 15 minutes. Like the inhalers, younger children will likely need to use a mask instead of a mouthpiece. Regardless of the delivery system, it's important to take your asthma medication as directed and follow all manufacturer instructions. To prevent thrush, talk to your provider about brushing or rinsing your mouth out after taking inhaled medications. Read and follow the cleaning instructions for your delivery system. Inhaler actuators should be cleaned weekly to make sure they don't get clogged. Always follow instructions on the package insert, as some can be cleaned with water and some cannot. Spacers should be soaked in hot soapy water once per week for about 15 minutes. Swish it around in the water, but do not scrub inside the tube. Rinse and let air dry in a vertical position. After every nebulizer treatment, separate the parts in pieces. Hang the tubing to drip dry, but never place the tubing or compressor in water. Wash the remaining pieces of the cup and mouthpiece or mask in hot soapy water, rinse, and then allow to air dry. Or you can wash them in a small parts basket on the top rack of the dishwasher instead. Disinfect your nebulizer twice a week. Take those same pieces that we washed after each treatment and soak them in a solution of 1 part white vinegar to 3 parts water for 1 hour. Rinse and air dry. Some brands allow you to disinfect in boiling water instead. Always read and follow the instructions for your specific product.
You'll know that your medications are working when you have asthma symptoms less than 2 days a week with no more than 1 episode in a single day. You are using a rescue inhaler less than 2 days each week. Asthma causes less than 2 nighttime awakenings per month, and oral steroids are needed no more than 1 time per year. Another way to monitor your asthma is to use a peak flow meter. This device shows how well air moves out of your lungs. Tracking your personal best might help make you aware of an asthma episode before it becomes a severe flare-up. Every child with asthma should have a written asthma action plan to help you remember routine asthma care and know how to handle symptoms as they arise. Share your child's asthma action plan with anyone who cares for them, including babysitters, grandparents, and their school.
Asthma plans are divided into 3 zones based on a traffic light: green, yellow, and red. You want to be in the green or healthy zone. This is when you have no symptoms, no nighttime cough, and at this point your action plan is to avoid known triggers and continue with controller medications. You are in the yellow or caution zone if you are coughing, wheezing, your chest feels tight, you are waking at night with a cough, or feel short of breath. You might be experiencing cold symptoms. If so, take your rescue medication 3 times a day, increasing to every 4 hours if needed. Remember to keep using your daily controller medication as prescribed. Call your provider if you are needing your rescue medication more than 3 times a day for more than 1 to 2 days, or if you're not seeing improvement. If you need it more than 4 times a day, follow the red zone plan. When you are in the red or danger zone, breathing is hard and fast, your skin might suck in at the base of the neck or between the ribs, and you're not able to speak in full sentences. In this case, immediately take your rescue medication. If that does not improve your symptoms, call your provider or go to the emergency room. Call 911 if your child feels respiratory distress, extreme shortness of breath, is struggling to breathe, is limp or listless, lips or fingernails are blue or gray colored, or they have trouble speaking or drinking due to difficulty breathing. The goal of the action plan is to help you control asthma symptoms and keep you out of the red zone.
In childhood, I had severe asthma, and that continued as a teenager. And I continue to have asthma. I do take asthma medications, but it's become much more controlled and now really doesn't interfere with my doing anything I want to do. I think I'm much more active now because of taking asthma medication on a regular basis. I like to bike, I like to ski, I like to go hiking. I try and keep an active lifestyle.
Yeah, Elijah is pretty active. Asthma only time slows him down if he is sick, and that's usually, he has a fever or he's coughing or wheezing, but normally he lives a healthy life and very active child. Well, since going to Mary Bridge, my confidence has increased. I seem to have better knowledge with our respiratory therapists who give us tips and knowledge on how to use the correct equipment. So I feel very knowledgeable on caring with my child.
We hope that this video has helped you understand better what asthma is and how it can be managed successfully. Asthma is treatable and controllable. Just remember to minimize your exposure to asthma triggers and to take your medication as prescribed. Remember to take your asthma controller medicines even when you're feeling well, and to take your asthma rescue medications as symptoms indicate. When you have questions, talk to your healthcare provider or visit marybridge.org/asthma.